Begin with Way 31 Sydney Martin. She spoke to the state health department after received more than 300,000 calls for appointments.
I would recommend that if persons can't get through right now, that they wait a while, try to call back, and if not able to get through, then wait a couple of days and call back.
Dr. Karen Landers with the Alabama Department of Public Health told me she's aware the phone lines were ringing off the hook on Friday. Many people who called got a busy signal from the Department of Public Health, and Landers said just because you might soon be eligible doesn't mean you'll get an appointment.
We're looking at a supply and demand issue here, so be aware that we certainly do not have enough vaccine to vaccinate almost 700,000 people.
The decision for a soft transition into the next phase of vaccination comes as many healthcare workers across the state have received a vaccine, and some already are getting their second dose.
We felt like by looking at where we were in terms of vaccinating our healthcare workers and also where we are in terms of doing all we can to keep people out of the hospital, that this was an important move toward our broad-based vaccine strategy, which again is limited based upon the supply of the vaccine that we have.
She said vaccine appointments have to be scheduled accordingly to make sure vaccines don't go bad before they're used.
Once you puncture a vial, that vial is only good for a certain amount of time, and so when we are making appointments and when we are doing our vaccination, we have to appoint in blocks of people, for lack of a better word, so that we will assure the utilization of each dose of vaccine.